Good evening, everyone, and welcome to today's session on Cervical Cancer Awareness Month. This is an initiative by Voice of Healthcare, and our topic for today is a crucial and timely one. From screening to survival, the role of HPV vaccination and early screening in cervical cancer prevention. I'm your host, Subhangi Das, and I'm delighted to be guiding through this important conversation. A highly preventable disease, yet an overwhelming disease burden. That's cervical cancer for India, claiming an estimated 80,000 lives in India and 350,000 lives worldwide each year. Cervical cancer remains one of the leading health issues among women. For deeply understanding cervical cancer and its early screening, prevention, and treatment options better, we are honored to have Dr. Kanika Batra Modi with us today. Dr. Kanika is the Associate Director and Clinical Lead of the Gynae Onco Department, Max Super Specialty Hospital, Saket. It is indeed a huge privilege to have you with us, ma'am. Thank you so much.
Thank you. Thank you so much, Subhangi.
So, this year, the theme of Cervical Cancer Awareness Month focuses on early detection and prevention. Despite it being one of the most preventable cancers, a large number of women in India continue to reach oncologists when it has reached an advanced stage. Can you please explain what exactly cervical cancer is and how often do you see delayed detection translating into advanced stage diagnosis?
So, cervical cancer is basically cancer of the cervix. Cervix is the lower part of the uterus, which opens into the vagina. That particular part is called the cervix, and cervical cancer is the cancer affecting that particular part. It is one of the most common cancers affecting women. And so, if we talk about what are the risk factors for cervical cancer, the most important risk factor is HPV virus infection. HPV virus, that is the human papilloma virus. It is just like any other viral infection, but this particular virus, it just doesn't get out easily. It, a lot of times the virus comes and goes, but sometimes it stays on, and the persistence of this viral infection is what causes these oncogenic changes. That is, the cancer causing cells, they transform the normal cells into cancer causing cells, and the persistence of this infection, usually, there is a latent period of about 10 to 12 years in which this cancer develops. So, symptoms, if you ask me, what are the symptoms of cervical cancer? Cervical cancer symptoms, most likely it is asymptomatic. It is to be ideally picked up on screening. The screening test being pap smear and HPV virus detection. But other symptoms, if the growth is there, it could be abnormal bleeding. It could be intermenstrual bleeding. It could be postcoital bleeding, that is bleeding right after sexual activity. Or sometimes there is a foul smelling, watery discharge. These are the most common symptoms. Or there could be a pelvic pain, pain in the pelvis or in the lower back. Or, sometimes there are these vague pelvic pressure symptoms, increase in urine frequency, or when advanced stages occur, then more symptoms can occur. But this is how primarily cervical cancer presents.
And ma'am, why do you think there is a delay in detection? Is this because it is asymptomatic?
So detection is delayed, A, because of the lack of, let's start from first, lack of vaccination. That is one of the primary methods why and how we can prevent it in today's age and time. We have the HPV vaccine, we can give vaccine for it. And in terms of screening, we lack a good screening, robust screening program. There is a lot of social taboo associated with it. Women don't go out to get themselves screened. So, screening can detect cells which are abnormal before it has developed into cancer.
Okay, ma'am. So, cervical cancer has a survival rate of around 90% if it's detected early. Yet, it
Yes.
continues to be the second most common cancer among Indian women. What are
Hmm.
the early signs? Like you talked about it, but like
Right.
someone who doesn't know about clinical symptoms or something like that in their day-to-day life, in their everyday life, what are the signs that they can kind of pick up and might think that okay, this is time for me to get screened for cervical cancer?
So, screening is obviously there. Screening is to be done in asymptomatic women where nothing has gone. It is a part of routine screening. So, every woman from the age of 21 to 65, they fall into the bracket where they should get a pap smear. From 30 to 65, one should also get HPV testing as well, the human papilloma virus testing. It's usually a core testing which is done. So, screening is something that we need to do in order to pick it up early. Any abnormal cell, it is picked up. Any abnormal virus, it is picked up. And then we can just locally treat those areas before it develops into cancer. That is first. Then, in terms of symptoms, watch out for any abnormal bleeding if it is there, abnormal discharge if it is there. Postcoital bleeding is one of the commonest symptoms, that is bleeding immediately after a sexual activity. So, all these are symptoms of cervical cancer, early
Yes,
symptoms of
ma'am.
cervical cancer.
Yes, ma'am. Thank you so much. That was really insightful. Are there any particular comorbidity factors that can, kind of enhance the risk for cervical cancer?
Uh, so basically, if somebody has a lack of immunity, that is, they are immunocompromised, that is, somebody has got a disorder through which their immunity is reduced, then the chances of HPV virus persisting into your, genital tract, it is higher.
Right, ma'am.
Then, apart from that, if somebody has multiple sexual partners, getting cervical cancer is easier because of the viral infection load that can happen. Then, smoking increases your risk. Smoking has, a particular release of certain chemicals into the bloodstream, and there the ability of the natural immune cells of the cervix and the vagina to get rid of the HPV infection, that is reduced. Then even usage of oral contraceptive pills, these basically they change the pH of the cervix and vagina, and that leads to a change in the microflora of the vaginal tract, and somehow there has been an association of persistence of HPV infection. Then all these are, major risk factors as to why there is going to be persistence of HPV virus and then development of cervical cancer.
Yes, ma'am. So now coming to the point of awareness, we have talked about multiple sexual partners and all. I think the awareness, there is a lack of it in rural areas, especially, right? So most of the women are fearful or clueless about how the screenings are actually done, right? So kind of walk us
Hmm.
through the methods most commonly used and briefly give us an idea if a woman just goes to a screening center for cervical cancer, what can she expect, how it is done?
Absolutely, a big part is fear of not the test itself, but the mystery around it. What is this pap smear? And once a woman actually knows what she's going to go through, it's much easier to tackle that problem. So, what you need to think of when somebody is undergoing this particular test is think of it as a short, respectful visit to the clinic. Usually, it takes about 10-15 minutes. You will have a brief conversation with your doctor. They're going to ask you any symptoms that you have, any pregnancy status that you have, any other problem that you're going through. Then there would be, a provider who is going to be around and she's going to make you comfortable. There is going to be an examination room that is going to be there. You're just going, it is a pelvic examination which basically consists of somebody having a look at your cervix. There is usually a speculum. A speculum is basically an instrument. It's a small instrument that goes into the vagina of a woman, and through that we are able to have a look at the cervix and take the smear which is called the pap smear. It is just like, a very painless, I wouldn't call it painless, but it's just slightly discomforting, but not a painful activity per se. Pap smear is just, somebody puts in a swab inside you and takes the cells out. nothing. It's as good as somebody, just putting in an earbud into their ear and taking it out. That's all that we do in pap smear, and even HPV is tested just like that. HPV, what it checks is the presence of human papilloma virus. These are, again, the virus, and a co-testing with pap smear is done in that. So it's a very quick and brief test. Then there are these advanced tests like colposcopy, in which we have a deeper look at a greater magnification to understand the deeper things. But that is done only and only if there is something abnormal in the pap smear or in the HPV virus. It is not routinely done for screening. So, what a woman should really expect from a good screening facility is privacy, a calm explanation of what the procedure is going to be, and a basic test which is not painful. It is just something that if you go with a prepared mind, there is nothing to it. And a clean answer as to when will I get the results. Usually it takes about 3 to 7 days depending upon what the situation is, and some amount of mild spotting can happen after the test, and there is nothing wrong with that. So
Yes,
the
ma'am.
idea is to just avoid scheduling a pap smear when you are bleeding or when you have any active infection going on. That's it.
Right. Thank you, ma'am. That really was a myth bust. I personally had a lot of disbelief regarding getting screened for cervical cancer because I thought it's gonna be painful. I believe a lot of other women also think
Hmm.
that okay, this is gonna be because as you said, taking a swab and could be a little scary, right? So that was an interesting myth bust. And speaking of prevention, in a lot of cases, transmission happens due to lack of healthy practices. We have walked through this. Now, coming to the treatment front, you have been an expert in this field for many years, and from your experience, can you please elaborate on how the treatment for cervical cancer has transformed over the years?
So it's easy to say clearly that cervical cancer prevention is not about having a perfect behavior. It is about taking some practical and high impact steps that can prevent cervical cancer. So the one of the most impactful things that we can do is do an HPV vaccine. It is one of the strongest and most effective tool available in today's age and time, and ideally, the age of giving this vaccine is before a woman is sexually active. So, typically, in most of the immunization programs, it starts as early as 9, and ideally, it is to be done before a woman is sexually active. But if you see the guidelines, till when can one take this particular vaccine? If, in India, at least, we have the guidelines that say till up till 45. But after a woman has been sexually active, we don't know how effective it is going to be, because we don't know if she has already built the immunity for HPV virus through the natural course of disease. That is one aspect of it. Then, in terms of prevention, using barrier protection, especially with new partners, can help. And the skin of the partner, you need to just be sure that there is no active infection going on. And you also need to know that a barrier doesn't prevent it 100%, the transmission. Then avoiding multiple sexual partners and using protection with newer partners, it's obviously something that is a preventive thing. And you don't need to ignore symptoms, and you don't need to self treat yourself repeatedly if you have any infection. Then keep your screening testing regular. As we told, the screening needs to be with respect to pap smear and HPV virus testing. Keep yourself regular on the schedule. You don't have to get an annual testing. Once in 3 years is absolutely what is recommended. And you need to strengthen your body's ability to fight off the infection. If you have smoking, you need to give up on that. If you have any immune disorders, or if you have any uncontrolled diabetes, or if you have some nutritional deficiencies, you need to work around that, and work around on your stress as well. Stress also reduces body's immunity. So whenever I have somebody who comes with HPV virus positive report, I tell them that you please need to reduce your stress and strengthen your immunity. Most of the times, HPV infection just goes away. It doesn't do anything at all to you. It's your stress that kills you more than the HPV infection. So take it easy over there. So vaccinate, screen, use protection, watch out for early symptoms, and just be cautious of the sexual partners that you have.
Yes, ma'am. And we have been talking about vaccines. So we have our India's most indigenous vaccine. I think it's Cervavac. What is your personal opinion on it and other available vaccines in India?
Yeah, so Cervavac is a recently launched vaccine. It's the Indian vaccine that has come. It is effective against four of these, viral strains that are there. And the other ones that is there, that is Gardasil 9 and 4 is there. So Gardasil 9 is the one which is effective against 9 of these immunogenic, the viruses that are there. So in terms of the largest number of strains being covered, it is Gardasil 9, which covers maximum number of strains. But yes, Servovac is good and even Gardasil 4 is good.
I think Cervavac is the more affordable option right now in India.
Yes, it is.
Yes. Yeah. Ma'am, with rapid advances in AI automation and robotic surgery transforming the entire oncology ecosystem, how
Yeah.
have these technologies evolved within gynecologic oncology department, both in terms of diagnosis and treatment? And what are the some of most favorite tools, innovative tools that you personally use?
Yeah, so treatment has transformed over the years, and cervical cancer treatment has moved from being, a blunt battle to something that is more personalized and customized. So, earlier stages are treated surgically primarily, and the sooner we detect them, the better we are at treating them and almost curing them. So earlier stage is better staging and risk stratification, and we don't overtreat them. And even if we give radiation, radiation also forms a mainstay for treatment of cervical cancer. Our radiation has also changed in terms of precision. It is a very precise radiation with least amount of effect on the surrounding tissues, even in locally advanced tumors. So now we have chemoradiation. And now we also have a lot of these systemic drugs, which are immunotherapy drugs, which we add to chemoradiation also or give it in other advanced cases also. And it has become quite a pillar in maintaining, the life of a lot of these selected subgroup of patients. And we do these receptor testing, PDL1 testing, and most effective screening strategies are there today, which are causing a pure public health impact, with HPV DNA testing being one of them. So, all this is how technology and precision has taken a form in dealing with cervical cancer.
Any your personal favorite one that you would like to share that you find the most effective?
So I think another one very effective thing is doing self-sampling for cervical cancer. That is also a very effective method where you don't have to go to a doctor also and just
Yeah.
collect your own sample, and you don't have to go through any discomfort, lack of time, lack of access. So if I am to choose one, I would say immunotherapy. It has really changed the way we treat cervical cancer now in locally advanced cervical cancer. It has really prolonged the life of so many of cervical cancer patients.
Wow, ma'am, that builds a lot of faith in the oncology services in India, especially with the presence of highly experienced and skilled doctors like you and methods. It's a really proud moment that India is also playing an important role in this oncology race. Ma'am, my next question to you would be: there is a misconception, a common misconception that HPV related diseases affect only women. Could you shed light on how HPV impacts men as well?
Okay, so HPV, it basically is a virus. It is gender agnostic. It can affect men and women both. So HPV can affect men, and the kind of tumors that it causes is in men is penile cancer in men. It can cause anal cancer in men, and it can cause even throat cancer. So a lot of times, if there is HPV infestation of the throat, even oral cancers can occur, and even men are advised to take HPV vaccine from that particular age and earlier age. So this is actually a misconception that vaccinating girls is enough or testing girls is enough. No, it needs to be at a society level, and that is how the overall load of the virus is going to go down in a
Yes, ma'am.
society. We need to, offer protection to women by vaccinating our boys as well, and it
True.
breaks the transmission chain. If in the society fewer infection means fewer circulation of infections within the system, and if we just rely on vaccinating the girls, it just puts the burden on half our population to prevent it. Whereas we know that HPV is a shared virus, that is where they get it from. That is how all the girls get the infection from.
Yes, ma'am. That's actually like something I think most of the people don't know. And thank you so much for enlightening us with the myth bust. Ma'am, coming to cervical cancer in women again, it disproportionately affects women in their most productive years of life, right? What are the long term physical, reproductive, and psychological implications you see in survivors? How can healthcare systems in India and families as well, communities as well, support life after treatment?
Sure, that's a very important question because survival is not just reaching the finish line. It is about getting somebody back into the society with dignity that they deserve and starting a new version of their selves with a different body that they have. So the long-term implications that we typically see is a physical and functional change. There is fatigue that lingers on for quite some time. There are bowel and bladder changes that happen after radiation. There can be pelvic fibrosis and pain that can happen, and even early menopause in women who have undergone surgery or radiation, which leads to its own changes like hot flashes, mood changes, sleep disruption, bone loss, cardiac dysfunction. Apart from these physical things, there are also sexual and intimacy related issues that a woman can experience, especially vaginal dryness or tightness and pain that happens with intercourse. Because there's going to be a shortening or narrowing of the vagina, whether we do surgery or radiation, and if rehab isn't supported during this time, the problems can worsen. So, and there could also be a loss of desire or fear of pain or fear of is this even safe, to have sexual activity after having had treatment. And there are also body image issues that are related to it. Then, of course, in younger women, we also have reproductive issues that come with cervical cancer. Whether somebody has surgery or radiation, it definitely does affect their fertility. And the psychosocial aftershocks that we see is basically, the fear of recurrence coming back in survivors, and there is a depression, irritability, and a sense of having been damaged in all of this is something that we see a lot and we need to tackle in a very comprehensive manner.
Yes, ma'am. I think it as a society, it's our role that someone who has already gone through so much, whose life is turned upside down, to stand by them, and palliative care, it's equally important. That's what you believe, I think. What is your opinion on palliative care for like
What is
cervical
my
cancer?
opinion on? Sorry?
And what is your opinion on palliative care?
Palliative care. Oh, of course, a woman needs to live with dignity. Palliative care is basically end of life care when we have decided that we can't do any more surgery or chemotherapy or radiation therapy, and a woman needs to be put on just quality care to give her as much comfort as possible.
Yes, ma'am.
And during
Thank
this time, we give, various sorts of drugs and ailments in order to bring down the discomfort or pain.
right, ma'am. Thank you so
So
much.
there needs to be given to them, no doubts about that.
Thank you so much, ma'am. We'll now be moving on to our rapid fire round, and I'll be asking you a series of quick questions, and I'd expect you to answer them briefly.
Sure.
Yeah. So the first question: the biggest myth that you have heard from your patients regarding cervical cancer.
I'm sorry, ma'am, I couldn't hear you.
Ma'am, am I audible?
Yeah, yeah, please.
Yeah. So my first question for the rapid fire round is that the biggest myth that you have heard from your patients regarding cervical cancer.
Is that I have no symptoms, I cannot have cancer.
Wow. Now that was an interesting myth bust again. A common
Because a lot of these
misbelief.
women, pre cancers and early cancers, women just don't have any symptoms at all. And screening is meant for normal women who don't have symptoms.
Yes, ma'am. I think most of us believe that until we see some signs, it is not the right time to visit a screening facility. So
Exactly.
that's where I think cervical cancer is different. It's completely asymptomatic, as we have talked about, right? So
Yeah.
a, a common misbelief regarding HPV vaccination.
That vaccine is only for people who are promiscuous.
Right, ma'am. That's actually surprising. The one innovation that has drastically changed cervical cancer treatment.
So I think radiation therapy with respect to, image guided therapy that we have and how precise it is with least amount of side effects, that has been really a game changer with brachytherapy and all the new technology we have around it.
Wow, ma'am. One Indian healthcare system gap that you have noticed, and what can they incorporate to better support cancer diagnosis and treatment? Obviously, in cervical cancer.
So an organized and recall based screening method with tracking is what is something that the Indian healthcare system can incorporate to not just do a camp screening like that, longitudinally you just do it, but screen and communicate the results, remind them, and ensure there is follow up.
That's brilliant, ma'am. I hope this gets implemented soon. Is there any specific gap that you have noticed?
So, after somebody gets their abnormal PAPS or HPV report, till the time we actually treat, there is a lot of gap. So, fast tracking somebody who has an abnormal report to the colposcopy clinics to do the next set of treatment, that is necessary.
Yes, ma'am. One lifestyle change that can significantly reduce cervical cancer risk.
Hmm. Smoking, stop smoking.
Smoking.
Yeah,
And
because smoking really weakens your local cervical immunity, and taking care of that will basically let go of the persistence of HPV virus.
ma'am, the rate of smoking among youngsters, men, women, both obviously, have risen in the last few years. Do you believe that this is one of the biggest reasons why the rate of cervical cancer has also increased because it's directly proportional, as you said?
It is. It is proportional, and that could be one of the reasons.
Yes, ma'am. And as for my last question to you today, if you were given an opportunity to speak with all the women of India, what piece of advice would you give them that could potentially change their lookout towards cervical cancer?
So, firstly, I would say don't be afraid of the vaccine or the screening, and don't stop waiting for any symptoms to occur. because cervical cancer is one cancer in which you take ownership and you can prevent it. It is to a large extent before it starts, you can just cut it there and then. So practically, it comes down to boils down to getting HPV vaccine, getting screened even when you are absolutely fine, and when you have developed some symptoms, just do not ignore any abnormal bleeding, whether it is postmenopausal bleeding, bleeding after sex, or any foul smelling discharge. Just please don't negotiate with these symptoms. Don't keep googling them. Just visit the doctor the next morning. And the real shift that one would want is that it should not be a silent fear with which women are, living. It is something that you take ownership of, that becomes a part of your routine, and you go ahead and get yourself screened, vaccinated, treated, and you live with that clarity rather than ignorance.
Wow, ma'am, that was moving. Thank you so much. Your insights and clinical experience today has given us a deep understanding of cervical cancer, not just as a medical condition, but as a disease where timely detection, prevention, and effective treatment can save countless lives. Thank you so much, ma'am.
Thank you. Thank you so much, Subhangi. My pleasure.
And to our audience, cervical cancer remains a major health challenge, yet it is highly preventable and treatable when addressed early. Every timely screening, vaccine administered, and treatment initiated is a step towards overcoming cervical cancer. Let us not wait for another tragedy to strike. Take action today for yourself, your mother, your sister, your daughter. Together, we can save lives, protect families, and give every woman the chance to thrive. Thank you.